or to the person who's out, just tending to the flowers who bends down wrong. Are these things that they can maybe prevent by coming to a chiropractor? You can teach them on how to bend and move and ways that they won't hurt their back?
Absolutely. If you look at the mechanics of the spine, a spine that is in good alignment is 18 times stronger biomechanically than one that is bad. So obviously, if your structure is strong, and the people that go to chiropractors on a regular basis, you have some personal friends that come in my office, and they come in for maintenance so they can do the things they want to do, go out and play golf and work in their yard without running the risk of injuring themselves. Now, does it make you impervious to injury? Absolutely not. But we can usually manage those cases much faster and get them out of pain much quicker if they've already been on a maintenance plan. And we teach them things to do out of the office as well. And the big thing is if somebody hurts themselves, put ice on it, don't put heat on it. That's a big mistake I see.
What do you see for the future? It's the progress of care has come so far. You talked about biophysics and research. Talk to us about that avenue.
Chiropractic biophysics is the most researched technique in the field today. It's had over 90 research papers published. And it approaches a spine from a three-dimensional aspect, which is very unique to the profession. And so that's where it has to go. I think for the chiropractic profession to progress, we have to get more research. Unfortunately, it's mostly self-funded. We don't get a whole lot of government funding. So usually chiropractors ourselves, we put the money towards research. And that's where I see the future. There's lots of research behind what we do already. And now it's disseminating that information to the public. There's some really good websites that they can visit. One is idealspine.com. And that actually goes through chiropractic biophysics, the research behind it. You can actually look up the Medline research and read these papers if you're so inclined. My website, metrospineandrehab.com, has some really good information on it as well. It's got over 700 pages of information that they can learn about how to take care of themselves better.
It seems like everybody is trying to learn about how to diet, how to take care of themselves, but they don't spend much time worrying about their back and their muscular structure, which is the most important part of everything.
That's right. I actually have a background in competitive bodybuilding, and I competed for 14 years and won Mr. St. Louis middleweight in 1991. I had a structurally unsound spine, and my rib cage was completely shifted to the left of my pelvis. And so the workouts that I was doing was actually damaging my spine and unknowingly damaging my spine. And now I have permanent injuries that I have to deal with. So we try to prevent that. But the exercise craze, the diet craze, really it's secondary. Because if you don't have a healthy nervous system and a healthy spine, like you said, you can't go run or jog or exercise at the gym if you've got a bulging disc. And those are all caused by biomechanical alterations.
Can you just expect as you start to get older, because I feel it now myself, getting out of bed, my knees, my ankles hurt from playing soccer. If you've been active as a youngster and you start to get older, are those aches and pains, are those just normal?
No. And the reason I say that is because normal means no pain. If you look at the dictionary definition of what really true health is, it's all of your organs and systems functioning at 100%, 100% of the time. So you can't have one elbow that hurts and one elbow that doesn't hurt, and they both be normal. And so we look at normal means you can do what you want to do, you can be healthy, you can be fairly pain-free. Now sometimes we do damage and you can't unboil a hard-boiled egg. If somebody has herniated a disc, they're probably going to have some chronic pain issues that they have to deal with.
You also mentioned that you work on youngsters. How small can someone come, and when should a parent maybe realize that a child has something wrong with them?
Well, I actually take care of parents as they're going through the pregnancy, and they will actually call me and say, we're on the way to the hospital, we'll call you when the baby's born, and I've actually gone to the hospitals and have checked the children right there, or they'll bring them in immediately after. My youngest patient right now is about 3 months old, and she's been under care from day one. So it's exciting to see those parents taking a proactive stance with their children's health versus being reactive.
We talk about things like different kinds of running shoes and walking shoes that can adjust the way that your feet fit into shoes and your alignment of your spine. Is that all a fallacy, or is that part of the truth?
There's some science behind it, definitely. Obviously, you have to go with a good company. We use orthotics with a lot of our patients because one of my jokes is your posture is basically the start of your, it's the start of your feet. And the best adjustment can be 2 feet off, get it? So we look at if a patient's got fallen arches or maybe some old injuries to their ankles, we have to address that. So we will do custom-made orthotics and put them into the shoes to create an optimal environment for their posture.
What would you say to the guys out there? Because I know I fall into that category. You maybe tweak your back a little bit, mowing the grass or whatever, and then you say, well, I'll just get over this. It'll be fine in a week or so. Right. Your advice?
The pain will probably go away. They've done studies on that, and most back pain incidents will dissipate. The pain will be gone, but the reason for the pain may not be gone. So that's usually a warning sign. It's kind of like the red light coming on in your car saying, temperature's getting a little high or your oil pressure's not right, and you've got a choice. You can either address it or ignore it.
Now, you mentioned before being a competitive bodybuilder that you did some damage to your body. If somebody waits and doesn't get something corrected, how damaging or how harmful can it really be?
It's pretty amazing what I see when patients come in the office and I take x-rays and the diagnostic procedures that we do, the damage that some people can do at a very young age. I've seen bulging discs at 15 years old from people that their spines are very out of line and they're carrying a little too much weight. They exercise thinking that's going to help and they do more damage. So it's really, really important to go to a qualified chiropractic physician, especially that understands structural mechanics, to make sure that that's addressed first before you start into an exercise program or any kind of sport.
How big of an issue is the weight problem with the obesity just running rampant? If you take and maybe throw a 20-pound bag of sand over your neck, it just drags you down. Just being 25 or 20 pounds overweight, that's how much extra stress is on your body.
Absolutely. Anytime you carry extra weight, it can be damaging to the structure. But once again, if the structure is strong, it can handle the extra weight to a point. But it will affect things like knees and shoulders. But what happens is it starts to buckle the spine, and the spine really starts losing its normal curves, and that can lead to a lot of problems.
You mentioned the normal curve. What should be the normal curve of a back? We don't have one here.
Sure.
But
it's very easy to demonstrate from the back or the front. You should be straight up and down. So if I look at an x-ray, that spine should be perfectly straight, perpendicular with horizon. From the side, when we take x-rays from the side view as well, there are curves. A real easy rule of thumb is the curve should be around 40 degrees. So your neck should have a reverse curve of 40 degrees, your mid-back 40 degrees, and your low back 40 degrees. And we actually measure those angles, and if they're above or below that, we actually work to correct that.
What about posture? Everyday posture, because you find, especially myself, just sitting on the couch and you're all clumped over, that plays into this tremendously, doesn't it?
Absolutely. It's amazing how people become very conscious of their posture after we start posture correction work with them, and they find themselves doing things at home. I've got a patient who, on his x-ray, he's got a really bad left shift. He said, you know what, I sit at my workstation at work like this on a keyboard. He said, I can't move my keyboard. I said, well, you need to get a new job or you're going to destroy your spine. So he's actually making a change with his workstation. So those things, absolutely. Once again, that joke of I have 5 minutes in with you and you got 23 hours and 55 minutes to screw it up. So we try to make the patient aware of what can you do at home, at work, to minimize the stresses on your spine.
You mentioned earlier a herniated disc. What's that?
A herniated disc is when the spinal mechanics are so dysfunctional that you're placing too much load stress on a disc and it will tear the fibers. A disc is like a big jelly donut, and that disc material, the donut part, actually tears. And the jelly inside actually extrudes out into the canal. Some patients don't even feel a herniated disc. It depends on if it hits a nerve root or the cord itself. If it does, you're going to feel it. If it doesn't hit it, you won't notice it at all. So some herniated discs are actually asymptomatic.
Those sit between the bones.
Correct. Yeah, and they basically they don't act as cushions as much as fulcrums for movement. And that's been a lot of the misconception is, well, a disc is for cushioning. And yes, it does provide some cushioning, but actually that is a fulcrum for movement. And so when you load the spine, let's say a patient has a forward head posture, that actually can affect the low back. And it changes the fulcrums to the spine. And so it's very important to address that so the patient can get their spine balanced and loaded equally to minimize those kinds of forces.
How bad does it need to be before someone goes to surgery to get these corrected? Or can it be corrected through
such as chiropractic care? Once again, it depends on each case. Always try conservative first. I actually just finished putting a review out for the Council on Clinical